Today we're going to be talking about how to use your dilator. The first thing that we want to do is make sure that we're in a place where we have privacy and where we can really relax. You then want to make sure you are getting into a comfortable position. We want our head and shoulders to be relaxed and not coming off of the surface that we're laying on. So typically my patients will be a little bit reclined with pillows or in a bathtub without water. This just enables you to reach the vaginal canal without turning on any abdominals, because those can activate pelvic floor muscles, and the whole purpose of a dilator program is to relax our pelvic floor muscles. You're going to start off with the first size in whatever set that you have. Typically what I'll encourage my patients to do is start out just touching the dilator along your inner thighs. Check in with your body. Are you clenching everything? Are you already trying to kind of close your legs? Are those inner thigh muscles really turning on? If we're feeling like that is happening, I want you to take a couple of deep breaths and try and relax all those muscles. If we're doing fine with that inner thigh, touching with the dilator, then I'll usually have my patients hold a dilator at the vaginal opening. What happens then? Do we have that same clenching reaction, or are we totally fine? If we're totally fine with those things, then we'll just resume with the dilator progression. If we have any of that clenching at any time, we're just gonna pause, we're gonna breathe and check in with our body and see if we can't get our muscles to relax. When it's time to insert the dilator, usually what I will encourage people to do is just start out trying to insert a little bit at a time. And so if you're at the vaginal opening, first thing that we're gonna do is hold here, breathe. If we're doing fine, then we're gonna insert a little bit. I want you to take a nice big breath in as you insert. This allows the pelvic floor muscles to relax. When we're using a dilator, I want you to keep pain levels below a 2 or 3 out of 10. If we're going higher than that, it can impact our nervous system in a way that's not helpful. And so we're obviously here trying to help our bodies. And so we want to keep that pain level low so that we train our body that we don't have to be clenching or protecting when we're using the dilator. So if you insert and pain levels go up, you pause, you breathe, you wait for pain levels to go down, and then you can insert further. And so the first thing that you're working on is just trying to insert the dilator. Sometimes this can take a little bit of time where you're inserting incrementally, just a little piece breathing, a little piece breathing. Sometimes it goes in pretty easily. Once we are able to get the dilator in, we want to make sure that we can take it out. And so we may have to do the same thing where we take it out. If pain levels increase, we pause, we breathe, wait for that to go down, and then we can continue with removing. If all of that goes well, then I'll usually encourage people to turn the dilator like a volume dial. And so if you've got this in here, you can just kind of turn and see how that feels. If any of that increases pain, we pause, we breathe, and repeat. And so really anytime we're getting that pain signal, it's just our body trying to protect that tissue, and those deep breaths activate our calming nervous system and train our body that we don't need that much protection. When you get to a point where one size is easy, that's when it's time to progress to the next size. And you repeat the exact same procedure, just going up in size. Typically, what I'll encourage my patients to do is set a timer for 10 minutes. Use your dilator for 10 minutes. Whatever you get accomplished in that time is all you need to do for that day. Depending on what you have going on, your physical therapist may prescribe a different frequency for dilator use, so that's going to be really dependent on what you have going on and how sensitive your tissues are. But a good rule of thumb is if you have soreness after you use your dilator, wait until that soreness goes away until you use it again. Reach out if you have any questions or want some further instruction on dilators.